All right, well, let's just have a conversation. Windy hair, windy day. It's okay, y'all. We're good, right? So, what is a deep dive nurse? I will tell you, there is nothing wrong with a doctor practicing medicine. There's nothing wrong with a functional medicine provider doing their thing. There's nothing wrong with a nurse practitioner doing his or her thing. But I will tell you, when an RN is educated, it is extreme detail to other things that we pull out of topics that are not what a doctor would. They're not what like a physician assistant or a nurse practitioner would. Their design of training is completely different than ours. They are designed to practice medicine. There is a disease, there is an illness, there is a prescription. That is the way their schooling is designed. The way that RN school is designed, I have my bachelor's degree, so really I spent like $25,000 plus to tell you that I just absolutely love education. It is in our job description. It is in our scope of practice to educate. We are the ones that educate the patient on their medication when they're leaving the hospital. We're the ones that educate the patient on what they are going to have as far as a procedure. Now, the doctor's going to recommend the procedure. And if the patient has other questions, of course, they're going to say, let me talk to the doctor. Totally fine. But 9 times out of 10, it's the same thing that the RN said, because we are designed to be big thinkers, to guess what questions you're going to ask, because we already are going to come up with a easy solution in an understandable way for it to make sense and not scary. There you go. I've never really known of anyone having white coat syndrome when a nurse comes in. We are typically like the top 10 of the most trusted people in the world. Those that are nurses. Now, I'm so sorry if you've ever experienced like a mean nurse, a bad nurse, a nurse that let you down or things like that. But this is not where this topic is going. Because, there are doctors that have let you down. There are nurse practitioners that have let you down. Functional medicine, naturopathy doctor. All I'm going to tell you is when it comes to educating the community, when it comes to educating the public, when it comes to educating the world, an RN has it down pat. We are actually able to call ourselves a coach. Now, we have a license, we have a medical license, which is higher than a coach. But what may be nice is that whenever you hear someone say, I'm a menopause coach, let's coach you through the menopause series that you're in, or the phase of menopause that you're in, because you have someone who understands what you're going through. This is what I do. This is what I love. This is what I've done for 30 years. I have done hormone education. I've done nutrition education. You name it. As a nurse, I have done it. I have found that there has just been this really big squeeze down of what has been asked of me over those 30 years. And it has been about nutrition and hormones. What I have come to enjoy is that whenever I can speak to my clients who do not need a doctor's order you don't need a doctor's order. You can actually choose to book the appointment yourself with me. No doctor's order needed, right? Because you can actually have your genes tested. Yep, over 70 plus genes that we're looking at. We're seeing what's going on. This is not what's happening out there in the world whenever you are put on a GLP-1. This is not what's happening out there in the world whenever you are met with a registered dietitian, which is covered by insurance. RN services, they're not covered by insurance. Why? Because education is uninsurable. When it comes to your health education, have you ever received the insurance covering you to receive education? Right. You get a prescription. right? You get these 20-page these 20-page documents from your doctor's office when you go, and you're like, oh my gosh, what did they say? It's got your blood pressure. It's got, the diagnosis that they gave you. It's got the medication that they put on there, and it's all black and white. And if you have any questions, you're welcome to call them. But what happens when you're working with this RN and what I've done for 30 years? This is great. This is the information that I like to receive for my clients. I've never received this information from my doctor before. I can't believe anyone's never explained it to me like this. You took that 20-page document of my genetic testing and you actually broke it down in a way that I understand it. And it's great. And then here's the other thing is I don't need you coming back and forth to me to get services. Cue the person mowing their lawn right outside. That's what happens when you go live. There you go. So just know that I appreciate the education that I give because you know why? That's the deep dive. Your doctor gets to see about 30 to 40 patients a day. Okay? That feeds the cycle of the doctor, gives the prescription to the pharmacy, and the pharmacy is either going to take your insurance, compute it. This is all happening all from the triangle of insurance. Like I said, you don't need to have insurance. You know why? Insurance doesn't want to touch this. Why? Because it's so broad. Because no medical doctor wants to come and order this kind of complex test because it's going to come up with some beautiful information. Well, I think that's beautiful information and I think it's actually computable. How about if we talk about your Dutch test? How about if we talk about your genetic test? I know how to break all that down into simple, digestible bits that you actually understand. And you know what it does? It saves you time. It gives you the information that you need. Most people crave diagnosis. I just want a diagnosis. I just want an answer to what's going on. Just give me a diagnosis. But what if you actually had tests that gave you answers? That is beautiful. There you go. Do you need a doctor? No. Do you need a doctor's order? No. Do you need a referral? No. Can you make this decision yourself? Yes. I'm an RN. With a bachelor's degree. I've been doing this for so long. I own Self-Care University, OK, LLC. And I don't need to convince you. Because if already whenever I was talking, you're like, this is what I need. This is how clients have received information from me. Is even during our appointments, even during the breakdown of the information where you actually have what you need and what you need to know, it's readily available. I find it fascinating. Put hormones in the chat. Direct message me the word hormones. Direct message me the word genes, genetics. You want to know what's going on. Do you have the celiac gene? Do you have the gluten intolerance gene? Do you have MTHFR? Are you having miscarriages? What are your hormone levels like? What is your cortisol level? What are these levels that are not going to be coming, will never come from a blood test? Because you know why? Those are instant. And those are a snapshot of that moment right then. No. I want to know a series. I want to know what's been going on in your life. I want to know what's happening. Okay? People get DNA tests. Why? Because they want to know what is part of their DNA. This is genetics. This is testing. Do you need to be on a carnivore diet? Is Mediterranean diet is great? This is not a diet test. This is a genetic test that actually says this is why your brother can eat an entire pizza and lose weight and you eat a pepperoni and you gain weight. These are specific answers about you. And you know why the insurance doesn't want to cover it? This is my opinion, is because you cannot consistently keep coming back and need that test. Because it's one time. And they're not going to make any money on it. And by the way, your genetics test is less than $300, okay? That ginormous big hormone test that I'm talking about is huge. Yeah, it's less than $1,000. It's less than $500, okay? I'm telling you, if the insurance got involved, it would be a $5,000 test. You would save your 20%. And then next thing you know, you're thinking you got a good deal, but you're over here paying $1,200 for a test. When over here, it's really only like $400 or $300. Does that make sense? So, but this is one time. Okay. So I appreciate it because it gives you answers. You can take this information to your doctor and it's wonderful because it gives them information. Now, if you are a direct primary provider, I will tell you this all day long, you're going to tell me, and I know it because I hear it. It's okay. We do not need your services with Self-Care University, okay? Because we already do that in-house. And I'm going to tell you, you already do that in-house with a blood test. You don't cover the information that I do. You don't do what I do because if you all did, your clients would have the results and they wouldn't come to me. That is no shade. That's okay because you do what you do. Let me do what I do. Don't pigeonhole your client into, or your patient into a test that's actually going to cost them years and years and lots of money for them to not get their answer. The blood test is not going to give them the answer to the specifics. It's not. You're going to get on an estradiol patch. You're going to get on estrogen cream. You're going to get on the pellets. Those are all prescriptions. What about that is natural? What about that is looking at what are the natural causes? What is happening in your body? Are you wearing polyester? Polyester is a natural hormone disruptor. I did a ginormous speech on it the other day. You can find it at the Truth in Health on their Facebook page if you want. You can find it on their YouTube if you want. Are you wearing polyester? Why in the world are you on a steroid? Why in the world are you on a hormone cream when you could actually stop wearing synthetic products and stop using synthetic products? Because it doesn't feed the prescription meal. It doesn't feed all the other things. Get to the bottom of it. That's why you want a deep dive nurse. This is why I get so passionate about this, and I understand. I understand that I don't have repeat clients for that test because they don't need it. It would be a waste of their time and money to repeat it. So, we get the answers. What's going on with the thyroid? What's your calcium level? Okay, can we take a look at why you're having miscarriages? Can we take a look at why your skin is so irritated? This is why you want a deep dive nurse with crazy hair. I'm actually quite vain when it comes to my hair, but I just have not gotten in to get my hair dyed. I've been so busy. I love a good highlight, y'all. I love good self-care. I love it. I think it's so fantastic. But I've been traveling with my company, Cozy Care Wellness, and I've been speaking about polyester and hormone friendly and survivor safe and non-toxic things that are so great for our clients that we can actually avoid the cancer diagnosis in some ways. Do y'all remember that? I talked about breast cancer, prostate cancer, testicular cancer. Take a look at that link to polyester. Let's have a conversation about that. I told you, I am a deep dive nurse. Let's have a conversation. Or go to your doctor, get your prescription, go to the pharmacy, okay? Pay for your insurance, go to the doctor, go to the pharmacy. Okay? That's fine. Keep that triangle going, but I'm telling you, insurance is not healthcare. RNs are designed and educated, and it is our scope of practice to do this. No one else does what I do because it takes so long. I've actually done this for so many years that I've got you answers. I have the information that you need that's tailored right for you. Okay? So, the other thing that I heard someone say, and then I'll finish with this, is they said, but I don't know you. I don't know if I can trust you. Okay. Were you referred by me? Have you gone to Google? Have you ever Googled Self-Care University OK? The OK stands for Oklahoma, not OK. Right? selfcareuniversityok.com. Go there. I'll put the link right in here on the thing. Go there Ask me a question, send me a message, let's get some answers. There is access to a free 20-minute consultation, non-diagnostic, where you can actually ask me questions to see if we fit together. Boy, has that happened a lot. And I will tell you, I have a 90% rate of people who do those 20-minute chat calls, and it actually turns into something that they actually have value, and they book an appointment and they get what they need and they move on with life. They refer their people to me, their friends, their sisters, their cousins. I'm a multi-state licensed registered nurse, so I can practice in 43 of the 50 states, which is why I don't have a brick and mortar. I don't need a brick and mortar. I don't need a fire. I don't need a fire extinguisher. I don't need 4 walls that's attached to someone else. I don't need a business phone line that is inside of a building. I do this all myself through my own business, right? I actually teach people how to do this, but let's just stay in this vein of helping you. If you have questions, you only don't have the answers because you never ask the questions to me. I'm the one who runs my business. I'm the one who knows what I do and how I do it, and I don't gatekeep because I can't stand that. Okay? There you go. Let's get something on the books. Let's have a conversation. Let's talk. Or I will see you in year 1, year 5, or year 10 after you have worked with those other providers that I've talked about, and you're busted and you have tried everything and the creams and the pills and the things don't work. And then you come to me. I'm here. I'm ready. But the thing that I will tell you is I would love to see you before year 1, year 5, and year 10. That's statistically how I am hearing it when people come to me. They're like, oh, I've been going through this for 5 years. I can't believe that I didn't know that night sweats weren't a thing that was supposed to be happening. Night sweats are not a rite of passage for menopause. They're not at all. You don't have to have night sweats at all. Okay? You can do great. There are natural remedies, and you can choose to do what you want to do. The only thing that I don't do is I do not make suggestions to your supplements on Amazon or the big box stores. I only go through third-party supplement pharmacies. That's it. Now, when I said supplement pharmacies, those are actually natural products, not a part of the triangle. Third-party tested as efficacious as possible. Not FDA approved because it doesn't need to be, because it's natural. I know. Like I told you, I've been doing this for 30 years. I love what I do. I do public speaking. And I will tell you, I will talk to any doctor, any nurse practitioner, any physician assistant, cardiologist, oncologist. I have done it, and I have been asked to sit in those chairs and have hours-long conversation about where I come from. And I'm telling you, they've loved it. So, if you are a direct primary care provider, which means you don't take insurance, then you know exactly what I'm talking about, right? I will talk to you all soon.